listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static.
In today's episode, if you're looking for something new to add to your insurance portfolio, we're getting into the basics and resources for getting started selling under-65 plans. ACA 101 Selling Under-65 Health Insurance, written by Roxanne Anderson and Emily Ryan. If you want to expand into the under-65 health insurance market, where do you start? We're covering the ins and outs of the Affordable Care Act and selling under-65 health plans. The American Rescue Plan Act of 2021 expanded the Affordable Care Act, improving health insurance affordability to those younger than 65. The Inflation Reduction Act, or IRA, increased subsidies and added to the strength of the ACA. There's no better time to enter the under-65 individual health market than now. So we're giving all the info you need to know to get started. First, we'll define what the Affordable Care Act is, also called ACA for short. The Affordable Care Act is a federal law signed in 2010 that reformed America's healthcare and insurance landscape. Formerly known as the Patient Protection and Affordable Care Act, and colloquially called Obamacare, the ACA includes several key provisions that gave 20 million Americans access to affordable healthcare coverage in 2012. During the 2024 Marketplace Open Enrollment Period, OEP, 21.4 million Americans enrolled in coverage. Here are some of the key provisions of the ACA. The creation of health insurance marketplaces, or exchanges, the individual mandate, which required every American to have health insurance or pay a tax penalty. People with pre-existing conditions cannot be denied coverage or charged more for it. Children can stay on a parent's plan until they turn 26 years old. Preventative care at no additional cost. Subsidies or tax credits for qualifying individuals and families purchasing through the marketplace. The expansion of Medicaid for low-income adults up to 138% of the federal poverty level. The individual mandate penalty was repealed at the federal level in 2019. A select number of states have since implemented their own health insurance individual mandates and penalties. These include California, the District of Columbia, Massachusetts, New Jersey, and Rhode Island. Vermont has their own individual mandate, but they do not have a penalty associated with it. Now that you've had a brief history of the ACA, we'll explain why selling under-65 health plans is a great opportunity. The future of the ACA market is looking exceptionally bright for everyone: carriers, agents, brokers, and consumers. First thing we'll mention, ACA commissions are competitive and can be very rewarding if you're enrolling multiple household members. Just like with Medicare Advantage, Medicare Supplement, and prescription drug plan sales, agents can earn initial commissions and renewal commissions. Unlike in Medicare sales, ACA commissions are typically paid per member per month. For example, one carrier offers $19 initial and $16 renewal commissions in several states. Let's say you help enroll 4 family members in this plan. You'd earn an initial commission of $76 per month for the first year, which is a total of $912. In year 2 and beyond, you'd receive $64 in renewal commission each month, which brings your yearly total to $768. And these amounts are just what you could earn for writing one household. With the ACA, more people are eligible for ACA subsidies. The American Rescue Plan Act of 2021 expanded federal health insurance subsidy access for millions of Americans. Before, households just above 400% of the federal poverty line, which is the limit for subsidy eligibility, made too much to qualify for an ACA health subsidy. The income cap is now at 8.39% instead of 9.2%, allowing more households to qualify for financial assistance. In August of 2022, the Inflation Reduction Act of 2022 extended subsidies for an additional 3 years, through the end of 2025. Individuals can be evaluated for subsidy eligibility each year, and if they qualify, can receive subsidies to apply to a marketplace plan. Something important to remember: clients who choose to accept subsidies must report them at tax time to capitalize on savings for the upcoming year. More great news about adding ACA to your portfolio. It may only require one certification at no cost. If you sell Medicare Advantage and Part D prescription drug plans, you'll be familiar with AHIP and carrier certifications. In order to sell under-65 health plans, insurance agents must also complete a federal certification, the Federally Facilitated Marketplace (FFM) certification, or a state-based certification in states that have their own exchange. Carrier certifications aren't required. FFM certification is also completely free, unlike AHIP. Agents and brokers new to the ACA marketplace must complete the full individual marketplace training. Those who are returning to the marketplace are eligible to take a shorter training with optional review modules. Anyone wishing to proceed with FFM training requirements can find and complete them on the Centers for Medicare and Medicaid Services Marketplace Learning Management System, MLMS for short. Here are the steps for completing the FFM certification for new agents and brokers. Number 1. Create an account on the CMS Enterprise portal. Number 2. Navigate to the FFM training for agents, brokers, and assisters. Number 3. Confirm your identity. Number 4. Click on the Complete Agent Broker Training link on the Agent Broker Registration Status page in the portal. Number 5. Complete the training and exams, vendor or CMS training through MLMS. Number 6. Sign the CMS privacy and security agreements. Returning agents and brokers can log into their current account and proceed to step 4. Once you have completed this training, you should be good to start selling ACA health plans. Additionally, for 2025, CMS MLS platform will support mobile devices. If you're selling ACA plans in a state that operates in a state-based marketplace, follow the certification requirements on that exchange. Select states may require additional certification training. To learn more about these requirements, visit the resources in the episode notes. Moving on to our next reason you should add ACA plans, they will work nicely with your current insurance portfolio. If you're already selling other insurance products, like Medicare plans, why not add under-65 health plans to your portfolio? You likely work with clients who are under 65 or who have spouses or kids who are under 65 who need health insurance help. When you add ACA health plans to your offerings, you can better serve your current clients and any referrals that come your way while growing your commissions. Plus, your under 65 clients will eventually become leads for your Medicare business or the other products you sell. We recommend that agents grow their business and foster lifelong relationships with their clients by developing a Medicare pipeline. When your clients who have an ACA policy turn age 65, as their trusted agent of record, you could help them find a great Medicare policy that fits their healthcare needs. When getting into the under-65 industry, it's important to understand the ACA marketplace and exchanges. What is the ACA marketplace? The ACA marketplace, also known as the Federal Health Insurance Marketplace or exchange, is a website where Americans can go to buy under-65 health insurance plans. This website is healthcare.gov. Every state that participates in the federal marketplace will conduct ACA sales and other marketplace functions through this platform. Some states have their own marketplace websites or exchanges. These are independently operated marketplaces that conduct the same functions as the federal marketplace separately. Let's look at on-exchange versus off-exchange plans. ACA plans are available on the exchange or off the exchange. Plans available on the exchange include those bought through the federal marketplace on healthcare.gov, those bought on a state's exchange website, or those bought through an approved exchange enrollment platform like Health Sherpa. Off-exchange plans are those bought directly from the carrier. On-exchange plans must provide essential health benefits and follow specific guidelines set by the ACA. Only on-exchange plans can accept ACA subsidies. Off-exchange plans usually offer most, if not all, the essential health benefits as their on-exchange counterparts. However, individuals cannot use an ACA subsidy to buy an off-exchange plan. Learn more about on-exchange and off-exchange marketplaces in our blog post answering all your frequently asked questions located in the episode notes. Next, the open enrollment period and new SEPs. Every year, people can shop for and enroll in new under-65 health plans on the marketplace during the open enrollment period, OEP, which runs from November 1st to January 15th in most states, or during a special enrollment period, SEP. Your client may have an SEP if they've recently experienced any of the following: job loss, moving to a new zip code, a new child, a death in the family, coverage loss, marriage, divorce, a citizenship status change, a government error, a change in subsidy eligibility, a qualifying federal reason, losing job-based coverage, Medicaid, eligibility for Medicare, or coverage through a family member. To take advantage of an SEP, you and your clients must act within 60 days of the qualifying life event. We mentioned subsidies earlier. Let's look deeper into ACA subsidies and their eligibility requirements. Today, more Americans are eligible for ACA subsidies than ever before, thanks to the American Rescue Plan and Inflation Reduction Acts. What are ACA subsidies, and how do people qualify for them? ACA subsidies are an advanced premium tax credit designed to help lower-income and middle-income individuals and families afford health insurance. To qualify, someone must meet the following criteria. Income is between 100% to 400% of the federal poverty level, or FPL for short. Buying a health plan through the marketplace or exchange. Does not have affordable employer-sponsored coverage available to select. An important note on that last one. Since 2023, family members can access subsidized ACA coverage if an employee's cost for their coverage exceeds 8.39% of the household's income. This was thanks to the closing of the family glitch. All family members are now to be taken into consideration in the eligibility calculations, not just the employee. To estimate 2025 subsidies, use the 2024 income levels to calculate savings. The FPL for a family size of 1 is $15,060 annually. A family of 2 is $20,440. For a family of 3, it's $25,820. A family of 4 is $31,200. Then add $5,380 for each individual household member. Something important to note: individuals who fall below 138% of the FPL or their state's designated limit should qualify for free or low-cost health insurance through Medicaid. If your client lives in Hawaii or Alaska, please be aware that poverty guidelines differ. To review the full list of FPL guidelines, visit hhs.gov. We'll also have the link to that website and the link for resources from Health Reform Beyond the Basics. These can help your clients understand how their income will affect their health coverage. When helping your client apply for a plan, you'll work together to estimate how much income they'll have for the following year. Then they'll receive a subsidy based on that income estimate, as well as additional factors. When your client files their taxes at the end of the year, they may have to pay back some or all of the subsidy if they earned over their estimated income for the year. Alternatively, if they made less than their original estimate, they should get a refund of any additional portion of the subsidy they may qualify for. We've got a great episode on myths surrounding ACA, including income requirements. You know where to find the link. Okay, we went over what the ACA is, what the marketplace and exchanges look like, and subsidies. Next, we're breaking down the different metal tiers. Under-65 marketplace plans are categorized into 4 metal tiers: bronze, silver, gold, and platinum. Basically, these tiers can tell you and your clients how covered medical costs are shared between the policy and the policyholder, but not the level of care or the plan's covered services. The metal tiers for ACA health plans. Let's start with bronze, which has the lowest monthly premium comparatively. With this type of plan, 60% of covered medical costs are paid for by the policy. The policyholder is responsible for the remaining 40%. Bronze plans have the highest unsubsidized annual deductible comparative cost. Beneficiaries of bronze plans are not eligible for cost-sharing reductions. However, they are eligible to apply for premium tax credits. Next, silver. This is typically a moderately priced plan, with 70% of covered medical costs paid by the policy. The policyholder is responsible for the remaining 30%. The unsubsidized annual deductible comparative cost for a silver plan is in the moderate range. Beneficiaries of silver plans are eligible to apply for cost-sharing reduction and premium tax credits. Third on the list of tiers, gold. The premium monthly for this metal tier is high. The unsubsidized annual deductible comparative cost for gold plans is low. The monthly premium for this metal tier is high. Beneficiaries are not eligible to apply for a cost-sharing reduction, but they are eligible to apply for premium tax credits. Last, we have platinum. With this plan type, the policyholder only pays 10% of covered medical costs, while the policy covers 90% of covered medical costs. The monthly premium comparative cost is the highest for platinum out of the 4 metal tiers, and the unsubsidized annual deductible comparative cost is the lowest. Those with platinum plans are not eligible to apply for a cost-sharing reduction. They are eligible to apply for premium tax credits. And that's the basic rundown of the 4 tiers of ACA. You probably noticed as the metal tiers go up, the member's coinsurance responsibly goes down, while the plan's coinsurance responsibly goes up. The most prevalent tier in the marketplace is the silver tier, due to the ability to apply for subsidies. We recommend suggesting a silver plan to a client that qualifies for subsidies. Remember to consider your client's budget and what makes sense for them. Some clients may find a bronze plan paired with another plan, such as a hospital indemnity plan, to be more affordable and offer the coverage they're looking for. We have a free printable handout for understanding the ACA metal tiers. It's a great resource to show clients during appointments for quick reference. You can find the PDF in the episode notes. Now that we've covered a lot of the basics, let's go over new requirements for agents selling ACA plans. The 2024 Marketplace Final Rule dictates that agents must document a client's authorization to receive assistance for their ACA coverage decisions. Agents must obtain this consent before assisting a client with enrolling in a plan. We've created a form to document client consent and eligibility attestations, and call scripts to go with the consumer authorization form and eligibility attestation form to make it easier to compliantly collect client authorization and eligibility attestations. Staying compliant in your business practices doesn't need to be stressful. You have the unique ability to help individuals find affordable healthcare coverage. Your role as an agent is a special one. You may know that navigators are also available to help individuals find and enroll in on-exchange plans. However, there's a big difference between navigators and agents or brokers like you. Navigators cannot recommend one plan over another. You can help your clients understand the best plans for them based on their needs. By getting involved in this market, you're looking out for the best interest of your clients, and yours as well. Under-65 sales can increase your bottom line and keep your book of business booming for the years to come as the market is stronger than ever. The ACA health market has seen a lot of changes within the past few years. Here at Ritter Insurance Marketing, we're embracing the amazing sales opportunities that the ACA presents. We're excited to see your business grow with under-65 sales. If you want to learn more about ACA, check out our comprehensive agent ebook, The Complete Guide to Selling Affordable Care Act Insurance Plans, to boost your confidence and get started. If you're partnered with Ritter Insurance Marketing, you can reach out to your sales specialists for contracting opportunities. Before we end this episode, we wanted to give a special thanks to our friends at Quick Insured Brokerage, one of the Ritter Insurance Marketing family of companies, for their assistance with the information used in this episode. Thank you so much for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Roxanne Anderson and Emily Ryan. Script proofing by Sarah Ruppel. Recording and production by me, Tina Lamoureux. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Rate and review our show on Apple or Spotify.